I want to try to be respectful with your time because there's a lot that's coming at you in terms of opportunities. You're at an exciting time in your life here at this amazing high school. I was telling Leah earlier that I'm usually at the Museum of Flight at least twice a month with my 5-year-old. We absolutely love being here and what this place represents. So all of you are really privileged to be able to come here and have this in your backyard. But you're at an interesting place right now in your life. You're about to head off to college, if not in a few months, in a few years. You're going to have a landscape of opportunities available to you. And you're going to say to yourself, well, gosh, do I need to major in X or Y? Do I need to narrow down what I focus on immediately because that's going to get me to the best job, best graduate school, whatever it may be, as quickly as possible? And I'm here to tell you, do not need to do that. I'm almost 40, and I've spent the last 18 years doing any number of things not related to medicine, whether it was joining the military, getting a master's degree in communication, studying international relations. I took a really circuitous path, and I didn't know where it was headed. And it took a respiratory pandemic for it to all make sense. And so I'm not saying prepare for a crisis and just take a random path down for the next 15 years. There's going to be some strategy, but follow your passions. I was curious about worlds and skill sets that don't typically have anything to do with bedside care. I'm a pulmonologist. What's a pulmonologist doing studying communication? Well, it matters. How we talk to people matters. How we speak to the public matters. And so just to plug that as clearly as possible, don't follow dogma. You will be told that you need to do X or Y or Z to focus and get the best grades possible. Focus on getting great grades, but don't follow dogma. Follow your passion. Interesting things can happen. As you're thinking about different career opportunities, what does the world have in store for each of you? Maybe you're going to be thinking about public health, healthcare. Maybe you're thinking about becoming a doctor. I'm here to say that this is one of the most interesting times to think about that type of career. I'm not here to recruit you into the medical profession, but I think we're at an interesting junction. Here, hopefully entering an endemic phase of the pandemic, we're at a really interesting place right now when it comes to the future of healthcare delivery. We're moving a lot of things at home. So a lot of you probably have gotten tested for COVID-19, maybe down the road for flu at home. Maybe your parents, your grandparents have tested themselves for COVID-19 or flu at home. Maybe they've seen their doctor virtually on their smartphone. These dynamics are shifting how we consume healthcare. They will define how your generation interacts with a healthcare provider, how you maybe down the road as a healthcare provider provide care for your patients. It's not going to necessarily be in an in-person setting. A lot of care is moving to the virtual space. And I love showing that figure here. Right before the pandemic, 12,500 Medicare recipients utilize telemedicine. That means I click on an app on my smartphone, I see a doc within a minute. That number shot up to 24.5 million in 2020. Within a 12-month span, our parents or grandparents said, you know what? I don't need to see my doc in a clinic. I can see them over an app. And this is part of a movement here. Testing at home, medications at home, monitoring your vital signs through your Apple Watch, all at home. Everything is changing as we speak. We're in my role at Amazon, we're trying to think about the best way to create a seamless experience for all of you. If you have cough or sniffles, if you're having a fever, what's the best way for all of you to get tested? What's the best way for all of you to get treatment if you need it? And I guarantee you, if I were to ask each one of you one-on-one, is it, I'm going to drive downtown to the clinic, I'm going to make an appointment, I'm going to have somebody swab my nose, I'm going to wait 2 days for the result, I'm going to then wait for the doc to make a prescription, I'm going to drive to the pharmacy to get that script filled. If you had an easier way to engage in that experience, I bet you'd take it, right? Convenience is becoming part of what we're talking about, part of the shifting dynamics in healthcare delivery. It's consumerism. We want convenience. We want something that's customer friendly. And I think that the pandemic has really accelerated that transition here. People are testing themselves at home. They have an understanding of their health risk in a way that maybe they didn't actually have as much of an understanding back in December of 2019. We're talking about risk. We're talking about boosters. We're talking about if you're medically high risk, you need to do ABC. People now are understanding these things. Our lay conception of our health risk is that it has never been higher than it is now. And we need to take advantage of this moment. And I don't think our brick and mortar healthcare delivery system is ready for this moment. For the reasons I just said, it's really difficult to get therapy if you need it. There's lots of wait periods, lots of inconvenience. So what do? Maybe in the next 20 years, when all of you are making policy decisions, we're not going to have these access to care barriers. Everybody will have some type of healthcare insurance. Maybe pharmacists will be able to prescribe medications, right? Maybe we'll have standing orders for medications like an antibiotic for people that need it if they test positive for an infection. Things that don't exist right now, we are moving towards a different dynamic and how healthcare is delivered. It's delivered at home with convenience and seamlessness. That's where we're headed in your generation. But again, nothing gets done. Nothing gets done. Let me go back there. Who's going to pay for it? One thing you're going to realize as you make your career decisions, whether it's to go into medicine, science, business, whatever it is, economics drives behavior. Who is going to pay for healthcare innovation? Will insurers pay for it? Will Medicare, Medicaid pay for this type of experience that I was just showing you, this early test to treat at-home experience? Is somebody going to pay for that? Or are they just going to say, you know what, that's just convenience. We're not going to pay for convenience. I'm here to tell you that things are changing as we speak. Who here owns an Apple Watch? All right, decent number of you. I worked on the oxygen feature. Does anybody have the oxygen feature on their Apple Watch? Okay. You probably, I'm assuming maybe the customer reviews here aren't all that friendly. It doesn't actually work unless you're stone cold still and not sweaty. But it's signifying a movement more than anything. I think the feature itself actually has lots of bugs in it. But it's interesting that right here we can test our oxygen level. We're actually developing, some companies are developing rings that can constrict the arteries in your finger and measure your blood pressure. They can measure your heart rate. They can measure your respiratory rate. And you know what? When we just talked about economics driving patient behavior and change, guess what? Payers are willing to pay for this. We're seeing healthcare insurance companies say, you know what? We're going to pay and make this service, this benefit, this watch free of charge for our enrollees. So for all of you, as you enter the workforce, your healthcare insurance might say, you know what, we're going to actually pay for you to get an Apple Watch or a Fitbit because you're going to pay attention to your step count, you're going to pay attention to your oxygen level, and the more you're paying attention to that stuff, the more you're going to be mindful of your own health. Keep this in mind. 12 months ago, we were not having this conversation. We were not having conversations about early test to treat. We were not having conversations about testing yourself at home for COVID and flu. Within just 12 months, not only has the innovation pipeline changed, now we have actual stuff that industry has made that has gotten governmental approval, which will allow you to test yourself at home for these conditions. We have a policy landscape that enables it. The government says, yes, that's okay. That's no small thing. Crisis brings, to some degree, innovation and opportunity. I mean, I've been talking to you about healthcare innovation, technology. What is this going to look like for all of you? As you grow older, as you get into the workforce, as you maybe become providers, what does this look like for all of you? I think for the future doctors in the room, the future nurses in the room, you're probably going to be delivering a lot of care to patients virtually. At their doorstep, you're going to be traveling to their home. And it's ultimately going to be a good thing, because what have we seen in this pandemic? We've seen a militarization of our pandemic response. What do I mean by that? I'm a major in the Air Force Reserves. I trained down at Joint Base Lewis McChord as one of their ICU docs. And what was really interesting and poignant is that 6 months ago, those big, have you seen those big C-17s actually in the hangar here, but probably flying around Boeing Field when you guys are in class? Those C-17s lived down at Joint Base Lewis McChord. And 6 months ago, those C-17s were helping with the evacuation in Afghanistan. This picture is actually the C-130 that was helping out in Kabul, based at Joint Base Lewis McChord. In 6 months, it went from downrange in Kabul, moving Afghanis out of Afghanistan to the UAE, other places out of the country. 6 months, it went from Afghanistan to moving critically ill COVID patients from places like Tennessee to Ohio. My team was deployed, that's my critical care transport team at Lewis McChord. We were deployed literally using C-17s and C-130s to move COVID critically ill patients from Tennessee to Ohio. The same planes that were moving Afghanis, other American friends from Afghanistan to safety in 6 months. This is not sustainable. This is not a sustainable way to address and respond to a pandemic. We cannot rely on our military forces to back up our civilian healthcare system. This cost millions of dollars. Lots of people died because we didn't have enough resources. And what am I really getting at here? We don't have enough supply of healthcare workers, nurses, respiratory therapists, technicians, much less docs. We need a solution here. 40% of doctors by end of this decade, when you're well past college, most of you, I'm assuming, will have left the workforce. 30% of nurses will have left the workforce by the end of the decade. So as many of you might be thinking about a career in healthcare, potentially, even you going through training is not going to be enough to stamp the bleeding here. We're going to have a healthcare workforce crisis that the military will not be able to address. They will not be able to backfill the shortfall that exists now, much less in 6 years. I think technology is going to make it easier. Imagine if we're doing a lot of our healthcare delivery in seamless experiences at home. Imagine if I'm able to follow my patient with emphysema with an Apple Watch or something like it at home. That's less than driving into my clinic. That's less of my time in the clinic. It allows me to actually touch more patients in a time-efficient manner. So technology will be helpful. That's the common thread here. But that's why this all matters. Test to treat, these innovations at home, remote monitoring, all of these hopefully will help us address this big elephant in the room, this looming healthcare workforce shortage that all of you will be expected to deal with in some fashion. Either you will experience it as a consumer of healthcare or because you're part of the healthcare workforce. But these are the dynamics here that are going to ultimately impact all of you and your generation. This is something that's near and dear to my heart, and I think this is the last silver lining. You know, I talked to you about, even though I didn't say it, these sort of pandemic silver linings that I think will hopefully improve our healthcare system. This movement towards healthcare at home, more convenience, the willingness of payers to pay for interesting innovations so that we will keep better track of our healthcare, be more motivated and engaged in our own healthcare. Because I'm following my step count, I'm watching my oxygen. This militarization of our pandemic response and how that is bringing shining a big light on the problem that exists now, healthcare workforce shortage, and the ways in which we all have to contend with that. You know, I think hopefully there's some silver linings there that technology will help with that. But perhaps the biggest lesson learned here with the pandemic, more than anything else, is that we in medicine are terrible communicators at scale on issues that matter to the general public. Talking about why do we get vaccinated? Why is it important to get tested? Why should you wear a mask? When should you wear a mask? All these things, show of hands, have you found messaging at some point in this pandemic to be confusing from our highest officials? Yeah, almost everybody. That's why, this is a fascinating study actually done in part at the University of Washington. This concept that the biggest reason why the United States struggled more than other countries that are less well-resourced, the biggest reason why the United States struggled with the pandemic is because there isn't trust in governmental institutions. Other countries who had less money, that were authoritarian in their political models, didn't have enough ICU beds, they did far better than the United States because they had more trust between their citizenry and the government. We didn't have that, and we've suffered. All of you probably, I'm guessing, all of you probably consume a lot of your information on social media through a device. Fair to say that? I certainly do. Why does that matter? I'm not claiming to replace the New England Journal of Medicine, the Bible of medicine, with a tweet. And yet, this is just a proof and point that engagement matters. How we communicate matters. Clear, simple messages matter when we're talking about why you should get vaccinated. I posted this image, lungs ravaged with COVID, normal lungs, on Twitter. And I compared engagement with the most frequently cited article on COVID-19 in the highest quality medical journal, New England Journal of Medicine. And look at, I mean, the numbers speak for themselves. So almost 5.5 million views, engagements with a tweet. It's not research, it's just a tweet. It's a simple message. Versus 1.5 million engagements with the actual research on what COVID-19 is in the early days of the pandemic. What we communicate matters. The reason we've made so much headway on making people stop smoking is because we've clearly articulated the risks. But we haven't gone on public platforms and had confusing messages. We've just shown clear, simple visuals. Your lungs with smoking, your lungs without smoking. Your lungs with COVID, your lungs vaccinated. Something simple. I know all of you might not need that simplicity, but I think we do at scale need better ways to communicate. And that's going to be on all of you, yet again. So these are the silver linings of the pandemic, in my view. We are going to have this movement towards consumerism in healthcare, this trend of virtual care at home, and I think it's going to be a good thing. More equitable access to care, hopefully, at a lower price point. People are going to get what they want more conveniently. Hopefully, we keep people out of hospitals. That's the optimistic view. It's on all of you to make sure that actually happens. Payers, what are payers going to do? Hopefully payers say to themselves, you know what, we're actually going to cover these interesting benefits because it's going to keep people healthier. And why does this all matter? It all matters because we are not going to have enough doctors and nurses to care for all of you and your families in the next 10 to 15 years. We're losing more than we're replacing. So we need interesting technological innovation to be able to scale, to allow one doc to do more with less. And then lastly, how people are consuming health information. It is fundamentally changing. The greatest lesson of this pandemic is that we are terrible communicators in public health, and we need crisis communicators in healthcare at scale. We need a better way to communicate with people on why certain things matter to their individual health, to their community health. And it's going to be on all of you to make sure that we've learned those lessons.